As a school bus driver, Russell Coulson knows there can be bumps and turns in every journey. But a twist he did not see coming was his prostate cancer diagnosis a little over a year and a half ago. It started with a routine checkup with his family doctor.
A lot of people don't, men especially, are too macho to go to the doctor and talk about problems that they have. And it's basically what saved my life.
That checkup led to a referral to Dr. Raman, chief of urology at Penn State Health.
He was 68 years of age. He was presenting with some vague lower urinary tract symptoms and really fairly nonspecific complaints. But part of the evaluation for all of this is that his family doctor had checked a PSA level. And PSA is one of the tests that we use to assess for prostate problems, and one of these problems is prostate cancer. And indeed, his PSA level was a little bit elevated for his age, and his rectal examination felt abnormal.
Well, they did a biopsy, and they said that, well, there's like, I think, 5 steps in this cancer progression, and it was like, they thought at the time it was the 5th, which is the most aggressive. So I sat with Dr. Raman and decided that with my age, with everything that was going on, that a prostatectomy was my best alternative.
When I have patients who have high-risk prostate cancer, one of the big conversations I have is I want to leave as many options as possible for them in their treatment armamentarium. And so in that regard, I'm a really big proponent for surgery for high-risk prostate cancer. Why? Because if I'm able to cure them surgically, then wonderful, we hit the home run. But if they have worse disease, I have a fallback option to use after surgery, which is radiation therapy, and so I have as many options as possible.
With the treatment plan decided on, Russell's surgery was scheduled.
When we do these surgeries, the goal is we have to remove the prostate, we have to remove the structures attached to the prostate, we have to sew the bladder back to the urethra, we need to preserve all the vital pelvic organs, and then we have to harvest lymph nodes, and we have to take a good number of lymph nodes out really for staging purposes for high-risk prostate cancer. Thankfully, Russell recovered well.
Russell returned to work within weeks.
Life since, well, let's put it this way, I'm alive, which beats the alternatives.
His cancer now in his rearview mirror, but going forward, he wants all men to know the importance of talking to your doctor.
It's important, if it saves your life, what's more important? What's more important than that?